welcome to our webinar today that will be a combination of, will be all about the ABA declared Law Student Mental Health Day on March 27th. My name is Catherine Bender, and I am the programming director for the Nee Foundation. Hopefully many of you on here are familiar with the Nee Foundation, and if you are not, our mission and outreach is to raise awareness about depression and suicide prevention, specifically within the legal community. And we're named for Dave Nee, a law student who died by suicide while studying for the bar. He was a Fordham Law Class of 2005 graduate. And so our primary programs are outreach to law students and law schools. So we wanted to start a little bit today with just the origin of why are we doing a mental health screening for March 27th. And so I wanted to just say a little bit about the day, March 27th. About 2 or 3 years ago when I started this work, it came to my attention that the ABA had declared March 27th as Law Student Mental Health Awareness Day. And what I found in communicating with law schools was that there was a wide spectrum of understanding of that day. So for example, some schools would respond with, oh yes, we know that, and we actually center our wellness week around that week. Or some people would say we had no idea that was happening, or some people would say, well, we're on spring break during that time. And so we really found that there was sort of this broad understanding and commitment to the day. And then in the meantime, in some of my work before in higher ed, before starting with the Nee Foundation, I had been involved with programs offered by College Response. And in those programs there would be, for example, there was National Depression Screening Day, National Alcohol Screening Day, National Eating Disorders Awareness. And so what would happen typically on campuses during those days would be an event in which students would be encouraged to take these screenings face-to-face using pen and paper, and to find out whether or not they were at risk for depression or substance use or eating disorder. And so I was thinking, couldn't we do something similar to that on a national level for Law Student Mental Health Day, and have it in a way where there wasn't pen and paper, because Screening for Mental Health and College Response now offer online screenings. And so I reached out to Screening for Mental Health and to Joanna, whom you'll hear from in a minute, to say, hey, is this something that we could possibly do, because we really think that it would be a great way to fit into our program. And it's usually something that is available to schools at a fee, but Screening for Mental Health has generously offered it to for this program for free. So sort of now here we are, and the majority, the first half of this webinar will be responding to some of the questions that folks have had about the screening, and if you opted in, what the unique URL does versus if you don't opt in. And then we'll continue on with some other programming ideas around this March 27th day. And at any point, if people have questions, you should be able to type those in during the chat, and we'll do our best to get to those.
Okay, thanks, Catherine, and thank you to everyone who's called in today. I'm certainly very happy to be here and to be a part of this. As Catherine mentioned, I'm the program manager for the College Response program at the small nonprofit organization Screening for Mental Health, which is just outside Boston. And just to give you some quick background information about Screening for Mental Health, it's the pioneer of large-scale mental health screening for the public and provides innovative mental health and substance abuse resources, linking those in need with quality treatment options. Our programs are designed to educate, raise awareness, and screen individuals for common mental health and behavioral health disorders and suicide. The College Response program is a program of Screening for Mental Health, and it was launched in 2001, and we're currently in over 600 schools across the country. And College Response has programs for mood and anxiety disorders, eating disorders, alcohol misuse, suicide prevention, and resiliency. And we offer both in-person and online programming, which Catherine mentioned. So today I'm going to tell you more about the online screening program, which is being offered to all law schools for free from March 22nd through April 6th. And many of you have already opted in for your unique URL, and I'm going to talk a little bit more about what that means. And please, throughout this presentation, feel free to ask questions by chatting them in on the right-hand side of your screen, and I'll read those at the end of the presentation and answer them. So why does online screening work? So the anonymity of online screening can really reduce pressure and stigma for students. They may feel more comfortable taking a screening in private as opposed to, say, attending an event or sitting in front of a counselor. This could be particularly appealing to law students who may not want to appear weak in front of their peers or anyone else for that matter. And online screening allows students to learn more about their own well-being without them having to share that with anyone else at that moment. So online screening can also create a further reach as it can be accessed by all students. It can be posted online or sent out through emails, so you can really reach all of your students with the link. A student who may not realize that what they're feeling is actually a treatable disorder, receiving an email with this link to the online screening could be the nudge that they need, and it can empower them to take the next step and speak with someone. It also allows schools to provide students with referral information and alert them to the resources that are available to them. And it also provides school counselors with useful data about their student body. So how can students access this screening? So if your school opts in for a unique URL, the screening will refer students directly to the services on your campus. And we'll send you your unique URL, and you can promote this by sending it out in an email, as I mentioned, posting it on your site. You can promote it through social media or any other way that you think might work on your campus. And having your own unique URL will also give you access to reports about your student body. Students will also, through this initiative, be able to access the screening through our site Locator. So if you go to the link lawstudentmentalhealthday.org, it's going to lead students to a page where they can look for their school. And I'll show you this page in just a minute. If they're unable to find their school, they can still take a general screening, and that screening will refer them to the SAMHSA treatment locator, which has a list of treatment all over the country, so they can find treatment that way as well. So this is a look at the Locator page, and if you were to scroll down, you'd see more states. So that's what they'll see when they get to the Locator. And so here we're looking at Massachusetts, and we'll see the list of schools in Massachusetts who have online screenings. And as we scroll down, we'll see at the very bottom that's where they can take a general screening. So now we're actually looking at the screening tool. So this is a look at the home page. It includes a brief welcome message, which gives the user a little more information about what screening is and what they can expect to see after taking it. Our SMH logo is used here as a placeholder. On your screening, you'd see your school's logo. From here, the user can click on Take a Screening, or they can scroll down a bit and find out more about screenings. So here we see what happens when they scroll down. So this gives the user some brief information about the purpose of taking a screening. It assures them that it's anonymous, and it lets them know that it's brief. It's not going to take up a lot of their time. They can scroll down even farther to see more about how it works. They're going to select a screening based on how they've been feeling. They'll answer some questions in the screening. They're going to understand what their results mean based on the explanation given on the results page, and they can explore additional materials that are going to also be provided on the results page. So now we're looking at the screen that appears if someone clicks on Take a Screening. So instead of listing the screenings out by disorder, we're asking users how they've been feeling, prompting them to take the proper screening based on their feelings. So if we were to click on feeling empty, sad, and hopeless, this is going to launch us into the depression screening. So it begins with some demographic questions. Age is just one example of a demographic question. And then you may notice that the name of the screening tool is highlighted in the upper left-hand corner, the HANDS Depression Screening. So if you click there, and this is on every page, users can click on the name of the screening tool and be given information about the tool itself. So this is just another way we're trying to make people feel really comfortable as they're going through the screening. They want to know what they're doing, so we like to give them as much information as possible. We have added a question for law schools that have opted in, asking students what year they are. This information will be included in the reports that we're going to run for each school. So each school that has opted in will get reports specific to their school. And this is one of the questions that we've added. So after the demographic questions come the screening questions. And each question is on its own page. And as you make your selection, it nicely slides into the next question. And just to mention, this tool also works on a tablet or a smartphone. We do ask the question over the past 2 weeks, how often have you thought about or wanted to commit suicide? If the student responds positively to this question, they will be prompted to call the National Suicide Prevention Lifeline, dial 911, or go immediately to the nearest emergency room. So after completing the screening, users click Submit to be taken to the results page, which is shown here. And here we're looking at the page as if someone took it, responded consistent with depression. So again, these are non-diagnostic tools, so it's just saying you may have symptoms consistent with this disorder. So a follow-up evaluation might be something you'd be interested in. Underneath the results, we see a description of what this means. And under the description is where the referral text will be. And this will link those who are taking the screening back to counseling services on your campus or to the SAMHSA treatment locator that I mentioned earlier. And now if you look at the right-hand side of your screen, you'll see that users will have the option to print or email their results. So this feature gives the user the option to print out a PDF of their results or email results to themselves, a family member, or a counselor, or anyone else that they may want to. The PDF has no identifying information on it, but by emailing the results to someone, they are choosing to self-identify. And there is a message that pops up and explains that. Next, you'll see depression resources. So when a user clicks here, they'll be shown articles and resources relating to the disorder that they've just screened for. So here we see depression resources. And lastly, the user will be able to select whether or not they plan on seeking help. And this data is collected to this response and will also be shown in the reports that, and again, can give you a better idea of the impact that the screening may or not be having on your students' help-seeking behavior. We also include a library of articles for students to look through. So as I mentioned earlier, we do screen for other disorders. So you'll see alcohol and eating disorders on here as well. This is, if you were to click on depression, this is a library of articles on depression. We've got other categories to the right-hand side. So a student can kind of look through these articles and click on anything that's relevant for them. And so now I'm going to show you the administrative side of things. If your school were to sign up for a full year-long subscription, this is what you would have access to. And this is also where I'll be pulling reports to share with you following Law School Mental Health Day. So this is, of course, the login page that we're looking at. And once you've entered in your username and password, you'll see a snapshot report. So the report we're looking at here is for our general screening, which includes screening for alcohol and eating disorders. So you'll see those on here as well. It will show us how many screenings were completed and how many visits there were to the site. If there's a difference between the two, it's because some visited the site and never actually completed a screening. Circled in red shows the date range for the report, which can be changed to a custom date range. So yours will be customized from March 22nd through the 6th of April. If you decide to offer the screening in English and Spanish, and again, this would be if you were to sign up for a subscription, you would have the ability to filter the data by language. Below this section is screening data broken out by disorder. If you were to scroll down even further on this page, you'd be able to download a more comprehensive report that's going to show the results of the screenings and the responses to the demographic questions. Now we're looking at the Analytics tab on the left-hand side navigation bar. So this shows you the device that was being used to access the screenings, the percentage of people who completed the screening, as well as the average length of time it took someone to finish. This section will help you develop a better understanding of how your students are accessing the screening tools, and it may influence how you choose to market the screening. Clicking the Profile tab, you'll be able to opt into our site locator, which you've all been opted into if you've if you've opted in for the screening for 2 weeks. And this is where you would change your password and email address if you had a subscription. Lower on the page, you can add your social media links, which will then show up on the results page after a student completes the screening. And you can also sign up to receive automatic utilization reports to be sent out weekly, monthly, or quarterly. Another feature, I'm sorry, I forgot to advance the last slide. So this is where you would change your password and add your social media links. And another feature is that you would be able to customize your screening platform by clicking the customization tab. And here's where you would change the title on the welcome page. You can change the welcome message and the referral information. For Law School Mental Health Day, we've customized the screenings for you. But if you were to subscribe, this is something you'd be able to do on your own. And I encourage those of you who have opted in for a unique URL to take a look at the link that we've sent to you and make sure we have the correct logo. And if you'd like referral information to be something other than your school's counseling center, then please get in touch with me after this webinar so we can make sure we have the right information. Further down, you can change, oops. Oh, here it is. Finally, further down, you can change your the privacy policy and choose a color theme and upload your logo. Sorry, got lost in my slides again. And finally, you're able to review the demographic questions and add up to 5 of your own questions. And then you can also opt out of any of the optional questions. So as I mentioned, we've added the question, what year are you in law school for this initiative? You'd probably want to opt out of, say, what's your residence, or are you accessing the screening module as part of freshman orientation? But yeah, so those are all optional questions, and then for you guys, we've added the law school question. So how do you get the word out about these screenings, and how can you let your busy students know about this resource and that it's available to them? As we've mentioned, you can send emails, you can post the link to your website or any student portal that students may use on a daily basis. You can share it in online group discussions or possibly post or hang flyers around campus. We've also created some social media posts that were included in the email that was sent to those of you who've opted in, and I can share it with all of you also after this webinar. And so here's a look at some of the sample tweets that you could use, and also some Facebook posts. And of course, you can create your own. Maybe there's something that is particular to your campus that we haven't captured in our social media posts. So these are just examples. And so before I hand it back over to Kate, I just want to emphasize that this is a really great resource that is available to your students for free for 2 weeks. And so I really encourage you to promote it. And I'm thrilled to have been included in this exciting and important initiative. And I'm going to hand it back over to Kate, and then, of course, I will be back on for questions at the end.
Okay, great. Thank you so much, Joanna. And just so people know, you know, I think it's so great that I know that there are schools who might not have wanted to opt in, and you know, the important thing is that students will still be able to take a screening, as Joanna mentioned. If your school has not opted in, the advantage, obviously, to opting in is that you will get some of that, you know, information about how many students took the screening and, you know, from where they took it, their tablet, their phone, their computer. And so I think that's all really helpful information, since all of us share the common goal of, you know, the health and wellness of our law students and promoting that. So hopefully there will be a lot of people who take advantage of this. One thing that I had mentioned to Joanna just before we started this webinar is that, you know, one idea for promoting it, I know March 27th is really close, but something that we did at a law school, and I don't know if that law school is on the conference right now, but we did just sort of a mental health checkup day, and the idea, it was very simple. We had a chocolate fountain, which was sort of the draw for why students came to us in the cafeteria, and then we had laptops set up. So I think that that would be something that would be fairly easy for folks to do, to sort of set up something, you know, and then if you have iPads available, the screening, as Joanna said, it really doesn't take that long, and then that way students could see other students were a part of this. So that's just an idea. So some other programming ideas, the ABA Mental Health Toolkit has been updated thanks to David Jaffe and a lot of other, under his leadership and a lot of other folks. I know, I don't know if we have any people on the line, but I know that they were really involved in making that happen. So that is available on the Nee Foundation website, and within that toolkit there's some ideas for wellness programming. Another idea I wanted to share with you that I know happened, or just happened at the University of Kentucky when we were out there. They have a Dean's Challenge, and the dean there had spoken about how, I mean, it's really, the faculty and students really got into the challenge. It was a month-long wellness challenge where folks got a different amount of points for partaking in a particular activity, and the activities ranged from yoga on campus to going running with some of their law professors, and the students were really, really into it. So that is one idea for if you want to make a Dean's Challenge for that week. It looks almost kind of like a bingo card. I'm not quite sure what the prize was, but the students and the faculty were definitely into it. Another popular thing that we have seen at schools, depending on how able they are to do this, is to bring in therapy dogs. A lot of students really like that. They really gravitate towards that, and schools have had success with that. Another thing that we've been asked about recently, and we know from the result of the law student well-being study that was conducted in last spring, that there's some concerns about disordered eating among law students, and so some folks have taken to having a dietitian or a nutritionist, or actually even having some like a culinary demonstration. And there's a variety of different things that you could do. So at one school, the dietitian was just talking about, you know, portion sizes and, you know, what to eat when you're on the go. The culinary demo could be, you know, how to eat well on a tight budget, things like that. So those are some ideas that really taken, you know, again, the whole idea that you know, the physical wellness, mental wellness, and emotional wellness. Some schools are fortunate enough to have, you know, dietitian students on campus, so and they're always looking for ways to, you know, get involved on campus. So a lot of times, I know that some schools don't have that, but it's an idea for those that do. Another thing is to do a wellness fair, and if you were to do a wellness fair, for example, having the iPads or tablets set up could be one sort of station at the wellness fair for students to take this screening. And it doesn't have to be, because I think sometimes we think wellness fair and think, wow, that's, you know, I don't have a lot of time to put that together, but it can be done very, very simply. So some ideas that we have used in the past and shared with other schools is to just, you know, the biggest thing is to have an area where you can have this. But something that has been effective at a couple of schools is to actually just have a table with crayons and markers, and as an art station, it helps to use the other side of the law student's brain, and so that can be very helpful. And there's there's been some empirical data that talks about how drawing and coloring can actually help reduce some of the symptoms of anxiety. Also, instead of just giving out stress balls, you could set up a table where you actually make your own stress ball, and if you're interested in that, I can send you the information. It's also very inexpensive. It really just involves having Sharpie markers, balloons, and sand. And at one school where we did this, the students were really into it and were like, oh, my friend just made a stress ball, can I make one? So that is, again, a simple idea. And then some wellness fairs have involved either a pull-up or a push-up type of challenge, so incorporating that physical aspect into it. So some other ideas, again, looking at the idea of wellness globally. So some schools have offered, and we support doing something about financial wellness. So whether that is someone who, you know, from the financial aid office or from, you know, Citibank or Chase or one of those to talk about financial wellness. We've also seen schools talking about sexual wellness, and as well as personal safety, even including something like a self-defense class. Also, we obviously want to encourage and promote mental health presentations, and the Nee Foundation, that's obviously what we do through our Uncommon Counsel program, but also the Lawyers Assistance Programs, or Lawyers Concerned for Lawyers, as they're called in some states. I know that they would be, at least in the states where we've worked, they'd be very willing to come out to the law school and talk about not just the services they provide, but to talk a little bit about mental health. Same thing with your campus counseling center. Some schools actually have a dedicated campus counselor within the counseling services dedicated to the law school. So doing some sort of mental health presentation is another programming idea. Some simple things to, again, promote this, the ABA declared Law Student Mental Health Day, and just in general, is just simple email reminders. I know often we get a lot of emails, but one of the schools that we work with, and someone who's on our advisory board, says that they send these emails at certain times throughout the year. So a reminder to faculty and staff, maybe about the signs and symptoms to look for, or even if you don't want to do that, to just say, you know, to remind the faculty and staff that you're there as a dean of students, or where they should send students if they're concerned. Maybe just a reminder about, you know, any trainings that are available, and we'll share with you in a minute a training that we'll be offering just for faculty and staff on March 26th. But share with them some of the statistics, some of the articles. I don't know if he's with us, but Dr. Benjamin work is often cited. Larry Krieger from Florida State, Brian Clark, and Dan Bolig. A lot of these folks are associated with the Nee Foundation, and we also just cite their work frequently that talks about sort of the impact of law school on law students. And ways, and sometimes I think that can be helpful for faculty to see it in black and white, just as a reminder. And then for the students, again, I'm sure they have all heard at orientation, or perhaps they've heard in the Nee Foundation or some presentation or other type of presentation what resources are available to them. But just as Joanna said about taking the screening could be that nudge that a student needs, maybe just a reminder, you know, here are the services that are available. I know one school with whom we work, and I can't remember the name of the school, they even have like a sleep study analysis at their campus counseling center. So even just a reminder to students of what resources are available to them, oftentimes for free, can be encouraging and promoting wellness. And a lot of times what we know, both anecdotally as well as factually, is that students are hesitant to seek help because of character and fitness issues. And so in states where some of those questions have recently changed, for example, New Jersey has changed, Louisiana has changed, Connecticut has changed, so I think Connecticut has changed, to clarify those issues and to sort of normalize it and encourage the students that it is okay for them to seek help. Another thing is to remind students about what exercise options they have on campus. Or I would encourage people to consider having a yoga instructor come into the law school. Or what we just found at one school is that there's really strong intramural presence, and so that is sort of feeds into the law student competitive nature, but it also is helping them to be active and socialize as well. So that's another, you know, sort of simple thing that can be done. So another option is we've been working in, you know, part of our mission is to help to reduce the stigma that's too often associated with folks with mental health concerns. And so one of the best practices for that is what's known as a contact strategy. So putting folks in touch with people with mental health issues. And that's often what we hear on our feedback forms after we've given a Nee Foundation presentation. Some folks will say it would be nice to hear from a lawyer or a law student who is successful with their recovery process or in seeking help. And I think a lot of times what happens is law students think it has to be one or the other. They can either seek help for their depression or they can be a successful law student. I think they don't see that you can be both. And so some of the resources that are available, there's the Lawyers with Depression website about, you know, a lawyer who sort of quote-unquote came out about his depression. And then these are some of the law professors. I don't know if any of them are online with us today, but Professor Jones is at Louisville Law, and his book is called A Hidden Madness, and it's about his experience as a law professor who came out about his bipolar disorder. Brian Clark, who's also a board member for us, is at Charlotte School of Law, has done a lot of postings about his experience. Same with Ellen Sachs at USC out in California, and Marjorie Silver, who's at Toro Law Center. So just, I think, for folks to recognize that it is very possible to be successful. It's possible to be a successful attorney. It's possible to be a successful law professor or law student, you know, and address the issues. I think that can be helpful. So even just letting students know about that these resources are available. Okay, it's not advancing, Joanna. Oh, wait, there we go. Okay. And so just some ways that we're trying to help. Again, we're partnering we'll be partnering again with Joanna to offer you a free webinar on March 26th and at 2 p.m. Eastern. And that's going to be really, we're promoting that specifically for faculty and staff about recognizing students in distress and appropriate ways to intervene. And you'll receive the link to register for that free webinar after the conclusion of today's webinar. And I think that you should be able to pass that on to folks as well, the link to the registration. And part of why we're doing this is that oftentimes when we go to law schools to deliver our Uncommon Counsel program, it's largely students who are in the room, and we encourage faculty and staff to attend, and sometimes we've even offered a separate program for faculty and staff. But we know that people's schedules are really busy and all of that, so we hear sometimes from schools that, you know, we would have liked for more faculty and staff to be here. Is there something you can do specifically for faculty and staff? And so we will walk them through the, you know, basically sort of what we would typically do for students, we've tailored for faculty and staff, and to say, okay, here are the possible warning signs that a student's in distress, and by the way, here's how that would show up in your classroom or in your office, and then talking about appropriate ways to intervene. And then for students, we're going to offer a webinar. We're frequently told that a difficult time for students is when they've survived the first semester of law school and they've come back and it's a couple of weeks into the semester and they get their grades back from first semester and they realize that, you know, they're not in that top 10%, or they're the way that they're responding to their grades they don't know how to respond because they're typically the big fish with straight A's. And so we're working with someone who's been an attorney for 18 years, but also is a recent graduate from the University of Pennsylvania's Masters of Applied Positive Psychology. And so we will be offering a webinar on April 1st at 7 p.m. and we're calling it Not Making the Grade, Responding with Resiliency to Law School. And that, again, we will promote that to you and in hopes that you will be able to promote that to your students. Again, the idea is the students will be able to log in at their own time, and we don't know if we were to offer this on campus how many students would come to it, just because we know about that competitive nature between the students. So we're hoping that offering this through a webinar platform will appeal to more students, and throughout that webinar we'll be able to address with them, you know, some of the tenets of positive psychology, and also looking at some of their cognitive cognitions surrounding their thoughts surrounding getting feedback that on grades. So that's something that we're also offering, and that will be April 1st. In general, what we typically say in terms of some best practices for those of you who are here and working on the front lines often with students is to just really, first and foremost, to talk about mental health, to not be afraid when you're talking with a student who is saying that they've been down or they don't feel like themselves, to not be afraid to use words like, do you think that you might be depressed? Do you think you might be experiencing anxiety? Again, the more we talk about it, the less we stigmatize it. And along with that, to be mindful of language, to try to put the person first. So, you know, to say that, you know, that person has depression as opposed to, you know, putting it the other way first. Try to avoid mislabeling. I say so often we hear people say, oh, you know, that person is bipolar, they must be bipolar, and they're using it as a derogatory term and not necessarily really knowing what it means, and they're saying it because, you know, they were happy one day and not the next. So I think just to avoid sort of the mislabeling and stigmatizing language, and when talking about suicide, to say that someone died by suicide rather than committed suicide. We encourage everybody, although you're probably all doing that because you wouldn't be on this, attending this webinar if you weren't already, but to try to stand up to the stigma that might even be within your own law school environment, and to just really be the person that is going to advocate for the law students until they can advocate for themselves. And so to be involved in, you know, helping to get some of those character and fitness questions changed, or to just, you know, really advocate that, you know, folks with mental health concerns are in no way weak, and there's no way that they should be prevented from practicing law. We also encourage people to follow people like the American Foundation for Suicide Prevention, the Suicide Prevention Research Center, Nee Foundation, Screening for Mental Health, all of those on Facebook or Twitter. Again, the more normalizing is the better, and ultimately to just sort of challenge the culture. I know we have a long way to go within the field of law because there are so many folks who, you know, this is the way it's always been done, this law school pedagogy, this is the way it's been, and that's the way it's going to continue to be. But I don't think we should just sort of stand back, and obviously you're not standing back if you're here, so just try to challenge the culture the way that you can, and ultimately to model and promote wellness, you know, and, you know, even just by encouraging folks to take the screening. And if you were to do an event where you had iPads, you know, I often say, you know, if people will wear a sticker that says I gave blood today, or, you know, I got my blood pressure checked, and I would love it if people would be just as comfortable saying, you know, I was screened today for depression, and just to sort of that idea that we don't have to be stigmatized about it, and we have routine checkups for our physical health, and so why wouldn't we do that for our emotional and mental health? Oh, whoops. So just some closing thoughts. At the end of this, you will receive the recording of today's session as well as a very brief survey, and included in that survey will be a question about what topics would you like to see covered in that March 26th webinar or future webinar. Please visit our website. As you know, right on our main website it talks about Law Student Mental Health Day, and you can find a link to the toolkit and a link to some other programmatic ideas. And if you're interested in contacting me, hopefully you already have my contact information, but if not, it's here as well. And I think that's about it. We want to make sure that we wanted to make sure that we would have time to get to any of your questions or concerns. So I think that you can just chat them in, and we should be able to respond to them.
Yep, and we have a bunch of questions already, so continue to submit, and I'll get started on reading a few of these. So one of the questions is, how do we go in about opting in now? So after this is over, I'll send you all an email with a link to opt in, as well as a brief survey and registration for the next webinar, so you can opt in then. Let's see. Another question is there a problem with hosting it on March 26th at our school, as we don't have many students on campus on Fridays? My answer would be no, absolutely, that's fine. Kate, do you agree? I mean,
yeah,
for,
no.
For National Depression Screening Day, we always say whenever works for you, you know, you can create your own. So I would assume that that would be the same case here.
Yeah, exactly. I mean, we recognize that that's a Friday, and I think for some schools it's actually the Friday before their spring break, or it might be the Friday of their spring break. That's why we're really grateful that, you know, that we'll be able to offer this from the dates that Joanna said, March 22nd, I think, to sometime in April. So yes, I mean, if you were to do an event, I think, yeah, that would be fine. I think, as Joanna said, the idea is we just want to get students to take it, and also to encourage them, again, sort of speaking out to the stigma, is to say, this is something that's going on nationally at law schools across the country during this time. So I think that would be fine.
Thank you. So another question is, what is the cost for a year subscription to the service? So for just the mood and anxiety screening, which is what you will all have for free for 2 weeks, is that's $215 for a year-long subscription. And then if you were to include alcohol and eating disorders as well, that would be $550 for a year-long subscription. Someone asked if this will be available after the webinar is completed. Yep, we'll send you a recording as well as the slides. What happens if a person has multiple diagnoses, example, anxiety and depression? Can they take both tracks in the screening? So again, just to note up front, these are not diagnoses. This is just a, it's alerting the student that they might have symptoms consistent with a disorder, but they would need to see a clinician to get a further evaluation. And yes, you can take multiple screenings. So if they were to take a depression screening and complete that, at the end they are asked if they'd like to take another screening. How long does the screening take for a typical student? It's less than 3 minutes. Very quick.
And I sort of love that idea that it only takes 3 minutes. Like, I know, I don't know, again, I keep going back to the donating blood and all of that, to say, like, do you have 3 minutes today to devote to your own mental wellness? I know the law students are really busy, but, 3 minutes, they could even do it on their smartphone while they're standing in line to get their coffee.
That's a good point. What happens after the 2 weeks of the free screening? So after the 2 weeks, after April 6th, we will go in and run reports and send them to you all with your screening numbers. So that's another reason why we're really encouraging you to promote it and get students to see the screening and hopefully take it. So and that's just for the people who have opted in. We won't be able to do that for the general screening, although we can run a big report to see if our numbers went way up during those 2 weeks. So that's what will happen, and then we can continue to support Dave Nee and the law schools here on out, moving forward. So we've been talking about ways we can continue this relationship moving forward. So, but in the immediate, we will be running reports and doing some follow-up. Someone asked, what does AFSP stand for? It's the American Foundation for Suicide Prevention.
Yes, and SPRC is the Suicide Prevention Resource Center.
Someone asked if they can see the student webinar in advance so we can anticipate questions and other follow-up from students. So that's directed at you, Kate.
Oh, the student webinar on responding with resiliency?
I think that's what.
I hadn't thought about that actually, like a pre-screening of it. I'd have to get back to you on that. I'm inclined to say that, I don't know. I'll have to talk because the person that I mentioned who's co-facilitating that with me, she's on the West Coast, so I'm not sure that we would be able to do a pre-screening of it, but I will check about that.
Okay, so someone also said that the link that they've been sent is working, and that's true. So the links are currently working. So technically, you have until before the 22nd to sign up. But if you've opted in and gotten a link, it is live right now. So you could technically be promoting it now. We'll be running reports from the 22nd through the 6th. But yes, that is true. They are live for those who've opted in. think that's it. There's some repeats in here, but I think we've answered most of the questions. So if you have more, please submit them. How can we see? Oops, sorry.
No, I was just saying.
How can we see what counseling information the students will see without taking the survey? So we've listed the counseling services that came off your school's website, and so if it wasn't the law school, it would be just the college. So if that's not right, or if you're just not sure, get in touch with me. I don't know if my email address is on here, but I'm going to be sending you all an email after this. So get back in touch with me, and I'll make sure for you.
Yeah, and I know that for the most part, schools have a connection with the counseling services, but I know that it might be possible. It might be that some schools might also want the Lawyer's Assistance Program listed for their state, because I know oftentimes the Lawyer's Assistance Program has a designated law school contact. So I'm sure that if people got in touch with Joanna, that information could probably be added.
Absolutely. And we just had a couple questions come in about exactly that, so thank you.
We're just really excited to be able to offer this, and we're really excited about this partnership and about how many schools have opted in already and how many people have signed up for today's webinar. And so if you please feel free to share any of the information that you learned today with other. Oftentimes there are listservs that we don't have access to that might be that the law schools in a particular state, all the deans of students all communicate with one another. So if there's we want to reach as many law schools as possible for this experience. So please feel free to pass it on.
Great. Yeah, I think that's all. And I would just like to echo what Kate said about how excited we are to be a part of this initiative. And I look forward to working with some of you. And yeah, thank you. Okay.
All right. Thanks.
Thanks so much.